Can I have collar? Then I have 2 sandbags.
Some bricks there.
Okay. And a forehand.
तो तसावर में जा उधर से इधर से
Yes, please. Okay. Where's move call is there? Then oxygen.
I haven't been booked. Then it close in center. Fresh is.
क्या हाल है आपका? Okay. Trachea?
Center.
Trachea.
Moving toward the left side.
Trachea move to the left.
सांस खराब हो रहा है.
Oh. Tender.
Tender on the right side. Tympanic.
सांस खराब हो रहा है.
Is it? How was it?
This tympanic. The lower side is a little dull.
डॉक्टर सांस नहीं ले सकता.
Okay. Give me a needle. So I will put this needle in the second intercostal space.
Second intercostal space, you know how to take it.
Then
There's a hissing sound that is coming out. Take it. There's a hissing sound that is coming out.
क्या है फयाज?
बेहतर.
ठीक है. Okay. How much is the blood pressure?
Blood pressure is 90 systolic.
And
90 by
pulse?
60. The pulse is 110.
Okay. Can I have cannulas? I'm taking blood for cross matching. This is for cross match. Okay, cannula. The other cannula. Drip, please. Fluids. What is that time? Okay. Foot tenderness.
Tender in the abdomen as well. Tender on the right side, more tender on the right
More tender on the right side. Pelvis.
Tender in the
Okay.
abdomen. Tender
Looks
in
like he has got
right
a
thigh.
fracture of the femur. So let me straighten it up. Okay. क्या हाल है अभी?
चक्कर आ रहे.
चक्कर आ रहा है. How much is the blood pressure?
Still 90 systolic.
Still 90 systolic. Okay. Let's do the rate for blood. And send a call to general surgery for first a fast scan and then emergency laparotomy. Maybe he needs that. Okay. Do we have the blood?
Yes, we do.
Let's start the blood. फयाज अब कुछ गुजारा हुआ है कि नहीं? थोड़ा बेहतर हुआ है? Touch. So let's examine the pupils. Pupils are responding. Okay. फयाज दर्द कहाँ पर हो रहा है? टांग में. So he is responding to vocal commands. He's at the verbal beat. Huh? अभी कैसे? बेहतर है. गुजारा हुआ है? हाँ? अभी भी खराब है. अगर नहीं तो फिर दोबारा हम शुरू करेंगे.
बेहतर नहीं है.
So the next step would be exposure, but we are not going to do that here. Lekin the practical side, we need to expose him at this point.
Right.
ठीक है?
Next,
Okay.
I'm going to ask, फिर आप group में से किसी एक को कहने के लिए वो जरा वो कर ले कि what are the steps that Tasawar will continue with it.
No, we are done.
Right. Right. What are the good things that we saw?
Patient बच गया कि नहीं?
नहीं patient अभी नहीं बचा ना. What were the good things that are established? In naturally, we are missing out on a few things deliberately as well to show you कि भाई आपने किस तरह से. What were the good things that are established? Since the patient was talking back, we didn't need to do anything else with the airway. Didn't need to put in an endotracheal tube or for that matter oropharyngeal airway or anything. So that was. फिर उसके बाद next step क्या किया उन्होंने? Airway की जब एक वैसे उन्होंने stabilize that was perfect. Cervical spine perfect. ठीक है तो उन्होंने cervical spine को भी address कर लिया. Right. Alright. So the cervical spine has been addressed as well. ठीक. Now, what else? What was the next step that he did?
Breathing.
He addressed the breathing bit, right? And you just said, right. And how did he address? So he sort of suspected that there was a tension pneumothorax, and that is why he put in a needle. That was good. Okay, what was the next thing that he did? Well, right, blood pressure. He was checking the blood pressure. So he did that well as well. So he was addressing the circulatory bits as well. Right.
When circulation was addressed and the blood pressure was about like 90
Yeah.
systolic, so then we thought there must be other cause of bleeding. So then we checked for the abdomen.
Very good. So he checked for the abdomen and he checked for the limbs as well. So he was able to. Right. What are the bits that you think he missed out on? X-ray, not at this stage. Primary survey, we would be sending him for X-rays, but during examination, what are the other things that could have been better? Now, one thing was, for example, one thing that we saw was probably we should have auscultated the chest as well, and that would have told you that breath sound would have been missing on one side. That would have given him a better right. Number one. Number two, when you put in this, when you do this needle decompression, that is only a temporary measure. It buys you a few minutes, right? Say 5 to 10 minutes after you buy it. Now, you have to make some arrangement for a definitive addressal of the chest issue as well. So if the patient has tension pneumothorax, the moment you put in your needle and you do your needle decompression, you ask your nurse to make arrangements for an underwater seal drain because you're going to put a chest drain in. See? Of course, that will come after that question, but by the time that gets arranged, it will probably be another 4 to 5 minutes. See? Now, this primary survey, it should not take more than 2 minutes, and he stayed well within that time. So within 2 minutes, he was able to do a complete primary survey, ABC. But during the course of this primary survey, you should also be thinking ahead, things that you need to do almost immediately after you have finished off with the primary survey, and that is when you put in your needle. When it came to circulation, he was okay there because he immediately took blood for cross-match and sent that across, so at least he addressed that bit in advance. Lekin ye baki cheez hai that you have to address as you go along as well. Of course, he addressed the limb as well, and once you learn a bit later on how to splint the limb and stuff, that will come in at this stage as well. You keep the limb straight and how you splint it as well. So,
Excuse me, how we have to examine the back of the patient, like if he got a fracture in cervical spine?
Right. Basically, the stations that you will be doing, one of the stations a bit later on will be telling you how to log roll the patient. Right? So log rolling may karke when you once you've exposed the back, you make a complete examination of the spine as well. That is going to come. For the time being, we're just going step by step. We just wanted to address the ABC components of it. But of course, the next step would be how to address the spine, how to have a look at the back, and how to roll the patient. Because if you start rolling the patient haphazardly, you don't properly log roll the patient, you can exacerbate any underlying spinal injury. So that you have to be very careful about. I think we'll give them a practical demonstration of the log roll in a second.
Exactly, that we will do that. That is tomorrow in the skill stations.
Right. Okay. So we'll do that
But
tomorrow.
today you presume that the cervical spine is injured, so you have to stabilize.
Once you start moving the patient for a complete statutory examination, of course you have to log roll the patient. That is when you do your rectal examination as well. You have a look at the back, the whole back, not just the spine, the whole back to see that there is for example, there may be any, and that we'll discuss tomorrow in any case. you may miss out very important injuries on the back as well. At times we land in theatre and we are told that the patient को firearm injury and he's had the firearm. We're looking at the entry, we completely forget about the back because the patient's on the table. When he's being shifted to the to the bed, later on in the ward, you realize that there's bleeding coming from the back as well because the exit wound is on the back. So you look at the back and then doing a complete head-to-toe examination as part of your secondary survey. So that will come in later, right? This was just to give you a flavor of what is going to happen in the stations in a little while, where you will be asked to form batches. Samir probably will already have sorted that out, and a couple of you will then be asked to go out. We'll make a scenario, and then you will come in and you will be following all these steps. And it is at that stage you will realize how easy it is to forget these steps. But once you make it a habit, after thinking up and where it becomes a reflex action, system one thinking up, then it will be easier for you to follow this step. And then of course you don't miss out on it. Because in pressure scenarios, you remember, and we've all been through it, you forget, and if you keep on thinking about theory and how you're going to apply it, it doesn't happen. Unless of course you have got a set mechanism, just go through it A, B, C, D, E, and whatever comes across, you're addressing that as you go along as well.
अच्छा, हम 4 में डिवाइड करेंगे आपको, ओके, 4 4 की डिवाइड करो और आपको 4 बैचेस हमने बनाए, एक बैच यहाँ पे रहेगा, 2 इस साइड कमरे में और एक उस कमरे में, ठीक है, and then we are going to practice exactly the same जो कि था. One of you is going to be the doctor, everyone is going to try and participate. एक डॉक्टर बनेगा, उसके साथ हेल्पर या नर्स, ठीक है, और एक पेशेंट बनेगा, आप ही में से, ठीक है, डॉक्टर और हेल्पर बाहर जाएगा, सिनेरियो आपको हम हेल्प करेंगे पहले, फिर आपको इंडिपेंडेंट सिनेरियो बनाएंगे, फिर उनको हम बुलाएंगे, and we will do exactly the same role play, ठीक है ना, okay, and you have to try